Hi, I'm Dr. Rutuja from Parency IVF Hospital. Today we are going to discuss some of the interesting cases which we have given success on. So this is one of our patient. She came from Davangere. When she came to us, she was just 30 years old and she was 9 years married. And everyone thought that she's not conceiving because she has PCOD, because her AMH was high and her rest all reports were normal. By the time in this 9 months, she had gone to multiple infertility experts and gynecologists, where she underwent multiple different kinds of treatments. And when she ended up with us, she had already 3 IVF failed. That means she has undergone 3 IVFs and none of them had given her even a pregnancy test positive. Looking at the reports, we started the journey, and during this journey, stepwise we evaluated what is the actual cause. So first target or first challenge was to get good grade day 5 blastocyst embryos. So first we focused on her PCOD parameter. We gave her certain treatment for 1 month, 2 months, and when we felt that she is all hormonologically normal, we started a IVF cycle. We did a IVF cycle for her, in which we were lucky to get 3 day 5 blastocysts, which we froze after doing a PGS. And after that we started the journey of recurrent implantation failure. When we talk about recurrent implantation failure, means when we are transferring good grade embryos in a good uterine lining, but still the implantation has not happened or the beta HCG was negative. And 3 implantation failure is a task which we have to think why it has failed. So patient had already come to us with multiple 2-3 hysteroscopies and 1 laparoscopy. So we had the videos and we thought it is of no use to repeat a hysteroscopy. But then I explained patient why not we should try ERA. ERA means endometrial receptive array. Endometrial receptive array gives us an idea about the window or the time of implantation. So normally a day 5 blastocyst is transferred at 124 hours plus minus 3 hours. For 80 to 85% of patients, this window of implantation is the time of implantation. But in 15 to 20% of the population, this window of implantation is either pre or post 124 hours. So we did a test called ERA for this patient, in which the endometrial receptivity came as pre-receptive. That means a day 5 embryo, if we transfer at 124 hours, the window of implantation was not open. That is why these embryos were unable to get implanted in her uterine cavity. So her window of implantation timing came as 143 hours plus minus 3 hours. So then we planned her for a implantation or a transfer of embryo at 146 hours. So instead of 6 gestone or 6th day of gestone, we transferred her embryos at 143 hours. That is 7 gestone injections we transferred, and we got a UPT positive. So the first time we transferred, she conceived, beta HCG was positive, it was a healthy singleton pregnancy. We did all required antenatal follow-ups, and at complete 37 weeks we did her elective C-section and we delivered a cute baby girl of 2.26 kgs mother side. So this was a very interesting case where every blame was on PCOD, but the cause of failure was not PCOD. Cause of failure was recurrent implantation failure because of pre-receptive endometrium. Because of the pre-receptive endometrium, embryos were transferred early than the window of implantation, because of which patient was not getting result. For more such cases and interesting stories, continue and follow my channel. Thank you.
If you have any questions, connect with us on the displayed phone numbers or visit our website to learn more.